Hey everybody, it's Caitlin. Welcome back to Corona Chat. Today is Thursday, September 17th, and today on Corona Chat we're focusing on COVID-19 and pregnancy. So there's a new study out in the BMJ that shares what we know so far about this disease in pregnant women. And this study is the result of one of these global collaborations led by the World Health Organization that includes researchers from universities in the UK, Spain, China, the US, and the Netherlands. And like so many of the other studies that we've talked about so far in Corona Chat, this is a systematic review and meta-analysis, meaning the researchers read all of the available studies on the topic and pooled together the data from relevant studies in order to make their calculations. And the benefit of doing this is that individual small studies might give conflicting results, but after reading through everything, we have a much better and clearer idea of what's actually going on. So to give you an idea of what read through everything means, right, this team searched through over 20,000 individual peer-reviewed articles and preprints, reading over 1,000 publications in depth to find the 77 studies that had reasonably good quality, rigorous information about COVID-19 and pregnancy. They really scrutinized these 77 studies to find all the possible methodological flaws and weaknesses, and then summarized the evidence that they found to give us a coherent 14-page article that explains everything. So, what did they learn? What they found is that pregnant women generally have the same symptoms of COVID-19 as everybody else, but they seem to be a little bit less likely to report fever and body aches. This is important because it helps us know that we don't need to keep our eyes open for any new symptoms, right? But it also means that that telltale fever might not be so telltale if you're pregnant. Many of the pregnant women were also asymptomatic, right? But this might just be a reflection of the fact that pregnant women are more likely to get tested for COVID than other people, so we're better able to identify asymptomatic cases. Women who are pregnant were also more likely to develop severe COVID-19 as compared to women who were not pregnant. Severe meaning that they, ended up being admitted to the ICU. Some of them needed mechanical ventilators in order to breathe, like severe COVID, right? The numbers here are not huge, right? This is not like every pregnant woman is developing really intense complications, but remember that most young, otherwise healthy women aren't developing severe acute COVID that requires hospitalization. Even if many do go on to develop long COVID. So we are seeing that, the numbers are small, but definitely there does seem to be a higher risk for folks who are pregnant as opposed to those who are not. The researchers also found that many more of the pregnant women with COVID were induced preterm as compared to those without COVID, but it's not really clear if that's because COVID was affecting their pregnancies or because hospitals were acting preventatively or, there were other things going on. Similarly, babies born to moms with COVID were more likely to be sent to the NICU, but it's not clear if this was because hospitals were being proactive, right, and just sending every baby born to a mom with COVID to the NICU, or because these babies actually were sicker, right? We can't tell that from the data that these researchers looked at. So, key takeaways. 1, pregnancy does seem to increase the risk of having a bad COVID outcome. So if you're pregnant, you want to make extra sure that you're wearing a mask, social distancing, washing your hands, right? Generally taking precautions to make sure that you do not get sick. Temperature is not necessarily a good indicator of whether you have COVID or not if you're pregnant. So if you're feeling under the weather and have a cough, better to err on the side of caution and get tested. Remember, we still don't know if there might be long-term effects of COVID that are different for pregnant women, but regular long COVID is pretty miserable, so preventing yourself from getting infected in the first place is the best bet. And right now, we still don't have good information on COVID in infants, so all of that infection control is extra important to also keep your baby safe and healthy too. That's our show for today. We'll be back next week with more information on COVID. As always, drop your comments, questions below. We'd love to hear from you. And in the meantime, stay safe, take care of one another, and remember that we are all in this together.